Welcome to Pathways to Success at PGCC. And now here's your host, Professor G.
Greetings, friends, and welcome to the best kept secret in Prince George's County, Prince George's Community College. And in today's episode of Pathways, we're taking you under the scope. Prince George's Community College has one of the best health and wellness programs in the state. And one of its leaders is not only leading the department, or heading a program, I should say. She is a Prince George's Community College graduate and knows what it takes to be successful. Glad to be joined today by Joanie Horstkamp. Joan, thanks for taking the time to join us today to talk about your pathway, because you got an interesting route, because you know what it's like to come through and to give back. Thanks for joining us.
Thanks for having me on your podcast, Professor G. I really appreciate it because there's so much information for the community to learn about our programs that we have for allied health and nursing. We have like 8 to 9 different programs in allied health, and we have multiple different programs, pathways for nursing programs. So a lot of information to go through, but thanks for having me. My heart is at Prince George's Community College because I am a graduate, as you mentioned, from the respiratory therapy program, which started in the 1970s. So most of my career, I was working at Prince George's Hospital Center, and for like over 33 years. And that led me into teaching clinicals for the hospital. And then I went in 2012, I started working as the director of clinical education for the respiratory therapy program, which is the top #1 in the state. I'm going to have to put a plug in for that. And as of this year, I took over the program director for the respiratory therapy program. So I'm very honored that I can give back to the community. And as we all know, since COVID, respiratory therapy is in the front line of careers that's so important for us to have, and we have a shortage of respiratory therapists. So any information I can give you, I'd be glad to share with you.
Interesting that you bring that up, because you've seen this program grow as both a student and now as a leader. How has it grown since you first stepped on campus?
So since I first stepped on campus, we were mostly getting Prince George's Community College students. And now we've opened it up to multiple counties in the state of Maryland, northern counties, southern counties, counties on the Eastern Shore, because there's such a need for respiratory therapists in the different areas in the state of Maryland. There's such a shortage. So now we are doing most of our courses. We're actually teaching synchronized remote so that we can have students from further away. And we have clinical sites that we place closer to their areas so that it's achievable for these students that don't live near the college to actually get a degree in respiratory therapy. As of different nuclear medicine also has the same format. So some of the other allied health programs also have that same kind of format. So it's definitely grown because the need for healthcare and nursing has quadrupled the need. So we definitely need more healthcare workers, and we're happy to do that. We're happy to be able to attain to outside areas that are further from Prince George's County.
Talk for a second about, how lucrative or what the job opportunities are like and what the salaries are, because we are in a generation whose pathway at the end of the day really comes down to wanting to secure the bag.
Right. I mean, money's always at the forefront of whatever career you want to do. And I'll tell you, when I was thinking about doing this, and I'll talk more about that in a minute, doing respiratory therapy, I heard you can make really good money with a 2-year associate's degree. And I thought to myself, I thought you had to get a bachelor's degree to be able to make any kind of money or have a career. So the community college level is excellent. And you will be guaranteed, 100% guaranteed, to have a job position, any hospital you want in the area, because it's so lucrative right now and we're such high demand right now. Starting salaries have come up for graduates, so 65 to 75,000 in the DC, Maryland, Baltimore region. Very competitive, higher than a lot of the other areas in the country, but very competitive in job salaries with, let's say, nursing or other allied health career fields. So along with travel therapists, since we had COVID, we had a lot of therapists that were actually traveling from different hospitals, state to state, and they were making, up to like 130,000 a year, maybe higher. So very lucrative. If you went to the board or the Bureau of Statistics, you can always look up different career fields and look up the job outlooks, and you can look up the salaries. And that's a good place to start when you're trying to decide which field to get into.
Talk to me for a second about the reward factor away from the financial security side of things. Talk about what it's like to be a part of a profession that is really all about, in many cases, first responding and helping people.
Right. So that's a great question. So there's many different allied health fields, and they all have their own specialty, but I'm going to speak on respiratory therapy, which we're considered practitioners in the hospital. And not a lot of people know about respiratory therapy, but I always kind of say that most people do know what paramedics do, and they're first responders. So I always say we're kind of like the paramedics in the hospital. So we're the first responders to all emergencies. So anyone that can't breathe or is having trouble breathing, whether it's a 1-pound infant to a trauma patient to maybe elderly people, just anyone who can breathe, we see. So the reward is it's just so amazing to be able to help someone to breathe better and help to save someone's life, because we're all a medical team. So we all work together as a team. We're all synchronized. We all have our own specialties, whether we're working in the trauma room, whether we're working in a delivery room, because we work with babies in the neonatal intensive care unit also. So we have a wide range of scope of practices that we utilize, and saving someone's life is just the amazing feeling, like to help someone breathe. If you can imagine, it's very scary when someone can't breathe. So a lot of reward, whether you're a paramedic, whether you're nuclear medicine, radiography, whatever healthcare field you're in, number one, it's good money. Number two, usually because you have empathy and you want to take care of patients. And so that's a very good feeling. You're also educating. You do a lot of educating on disease processes.
So is this man a career or a calling for you in particular?
Well, for me, it's been a great career. I always tell my students the best place to work in the entire world is a hospital. That's how much I like it. Best place to work. It's fun and it's exciting. It's rewarding. It's everything you could think of. Fast pace, critical thinking skills, decision making, because you're in emergency situations. And if you ever see on TV shows, like emergency shows, they'll always say, call respiratory stat to the ED, emergency department. So very, very rewarding that way. I personally came into the field because when I was a child, I've had asthma my whole life. So I'd go to the emergency room and I would see the respiratory therapist would treat me. And by the time I got to 11th grade, I knew that's what I wanted to do. Plus, I like the excitement. Whenever you're a kid, you ever ran after, the fire engines and, the ambulances, and you wanted to see that excitement. I knew I had that in me, the adrenaline rush. I like that at emergency kind of situations, some medicine. So that led me right into respiratory therapy.
Okay, we're going to pick up the pace. What do you see as the ingredients to a successful candidate who comes into respiratory therapy as a pathway to the future career?
So I would say somebody that has a passion, you have to have a passion because it's all of these programs are tough to get through. So you really need a passion to get through the program. You need a passion for science. You need a passion for learning about the human body. I would say you need a passion for taking care of patients because you're literally at the bedside taking care of patients all day long. It's a fast-paced career, so critical thinking skills. So somebody that's not afraid to get their hands dirty and to be able to get involved in taking care of patients. So that's kind of what I would tell students. It's a tough. All of the programs are very tough. So you have to be dedicated, determination, and have the desire. So I always say the 3 Ds you need to be successful. And then you take your boards and you have this amazing career. And it's been an amazing career for myself.
In our last couple of minutes, having been in the business for 3 decades, you've seen it evolve. What kind of innovative things are happening right now that students can come to PGCC and be on the cutting edge of learning about?
So we have state-of-the-art equipment in our lab, and we have a simulation lab that all of the disciplines use. So the state-of-art equipment, we have more ventilators in our lab, so respirators, ventilators we call them, than most small hospitals. So I would say we have the best respiratory therapy lab probably in the entire country. And that is not an exaggeration. So they get to, I mean, when I was a student, we had one old ventilator that barely worked. And we teach our students how to manage patients breathing on ventilators because they're 100% taking over their breathing. So that's a big part of what they'll be learning in our field. But we have state-of-the-art equipment for all the areas. For surgical technology, they have a beautiful lab. Radiography, they have all brand new equipment, really nice facilities for different learning. And we stay up with any new development, new treatment, new therapy with all of the hospitals that we're connected with because our students do clinicals. So anything that comes up the pike that they're doing in the intensive care unit, we learn that information and we teach it to our students in the classroom so that they will be up to date when they start doing their clinicals in the local hospitals that we send our students to. So all the hospitals that our students go to, any mechanical ventilator that they have for the different hospitals, we have all of them. So they're up to date with all mechanical ventilation before they even attend clinicals.
So there will be no surprises when they step off of campus. Joanie Horstkamp, thank you so much for sharing the knowledge about the pathways to allied health and, in particular, respiratory therapy, a true gem of the campus. Glad to make your acquaintance, my friend.
Thank you so much. Have a great day.
That's going to do it for this edition of Pathways to Success at Prince George's Community College. I'm Mark Gray, inviting you to step on campus and check out the best kept secret in Prince George's County.
Thank you for watching Pathways to Success at PGCC. For more information about Pathways at the college, visit our website at www.pgcc.edu.